Good morning. Welcome to What Matters for the edition dated Wednesday, 30th September 2020. My name is Kong Yu, as always, with you for the discussion of today. This time focusing on a commemoration, an annual commemoration, in fact, from a health perspective, something I did refer to on Monday because it was the day itself. World Heart Day 2020 is upon us, and today we're going to be speaking to our special guest today, my doctor of the day today, all about how we can actually better manage our heart health, as well as to get in the details as to cardiovascular disease, and also some advice as to how to better manage our overall heart health. Welcoming into the studios of TraXXfm, my guest of today, YBhg Dato Dr. Ghandhiraj Somasundram, who is the chairman of the MAA Medicare Cardiac Diagnostic Center Medical Advisory. Welcome, Doctor. How are you? Good morning.
Yeah, thank you very much. Good morning to you, Kong Yu.
Okay, thanks for coming in to speak about this, and we do appreciate your presence today. As we talk about World Heart Day, all matters to do with heart from a medical perspective, and much more. Yeah. So once again, I would like to welcome you, if you're listening out there, to our session on Facebook Live. If you like a visual cue as to the interview that's happening on hand right now, as well as, more importantly, your way to get interactive and also to post a question to Dr. Ghandhiraj, or that is relevant to the topic of the day. Quick hello to Liman Hui, Patricia Lim, Rose Rafina as well, for your quick and early hellos. We appreciate it. If you've got a comment or question, feel free to type it in the comment section. We are at TraXXfm Official on Facebook Live now. Hearts, the whole entire cardiovascular system, right? Something to take note of. Let's speak a little bit about that as a fundamental to set the tone right. Details on cardiovascular system, as well as the common manifestation of cardiovascular disease. Doctor, tell us more.
Well, the diseases of the heart actually really involves diseases of the structures of the heart, as well as the two principal arteries that come out of the heart, namely the aorta and the pulmonary artery, and the peripheral vascular system, and that is basically defines cardiovascular disease. And there are many diseases affecting the heart. One is people can have congenital heart defects, and children can be born with birth defects like holes in the heart. But the most commonest prevalent and predominant disease that afflicts mankind today is the coronary artery disease, and that is the blockages of the coronary arteries which supply blood to us. And you'll see, if you ask me about the manifestations, basically is chest pain, shortness of breath, angina, that is, ischemia to the heart, as well as, a heart attack called the myocardial infarction. So besides this, there are also other diseases that affect the heart. We have diseases of the aorta, where the aorta can dilate and they can have a dissection. You can have diseases of the valves in the heart. We have 4 valves in the heart anatomically, and they can become stenosed and it can become regurgitant. We can have diseases of the coverings of the heart called the pericardium. We get pericardial disease. We can also have diseases affecting the heart muscle, primarily giving rise to cardiomyopathy and weakness of the heart. You can also have tumors of the heart and rhythm disorders. So basically this whole spectrum of illnesses that covers the heart is what we actually see in day-to-day practice.
Wow, so that's a whole gamut of different possible afflictions, right?
Yes, entirely, yes.
Right. So you mentioned coronary artery disease,
yes.
Right? So that is that's one of the key illnesses or weaknesses of the heart. Or it's something that's more associated towards like lifestyle factors associated with poor lifestyle and
yes, indeed. Health. I mean, definitely. Well, you see, coronary artery disease is caused by various risk factors, and the major risk factors are hypertension, diabetes, hyperlipidemia, hereditary factors. It's genetically passed from generation to generation. Family history is very crucial. Obesity, as well as poor eating habits, and stress. And of course, coronary artery disease is a new age disease, and it is also, manifested secondary to economic, cultural changes, lifestyle changes, urbanization, globalization, pollution, and poverty, and so on. So it's a huge disease for the world to combat, because the reason why they're having this World Heart Day today is because of coronary artery disease, because it an estimated 18 million people die of this disease every year globally.
So that's a note or an inkling of the global statistics, right?
Yes.
So 18 million around the world, isn't it? Do we have any other key statistics to share, for example, like for Malaysia?
Yes, we are in Malaysia. We have been looking at the statistics from the Ministry of Health. You have about 18,000 people dying of cardiovascular disease in this country on a yearly basis. And it has been for the last 14 years. Every year, there's an estimated loss of about 18,000 people. And you find that majority of them are patients who are less than 70 years of age. And that's quite alarming. And what is more alarming is that people who are less than 40 years of age, between 30 and 40, developing heart disease and heart attacks and requiring invasive treatment like coronary angiograms, angioplasties, and even bypass surgery. And in the last couple of years, we find that women in Malaysia seem to have an increasing tendency to develop heart disease.
And it's pretty interesting. I mean, we've heard of many cases of people under the age of 40, like you were saying, Doctor.
Yes.
Suddenly, having heart attacks,
right?
And also sudden onsets of the manifestation of the issues, isn't it?
Yes.
And it's interesting also that you're saying that women, increasingly more numbers of women also developing, the disease. Let's talk about that first.
Yes.
When it comes to what the trend has been, or what it's evolving into.
Well, with reference to men, it is a men's disease. It has been because men are out there. They're stressed. They're breadwinners of the family. They have a higher incidence of diabetes, high blood pressure, obesity. Most working men do not have time to exercise. All of this culminates in coronary artery disease. But in women, they are fairly protected until they sort of have menopause. And after menopause, if they have latent diabetes or marginal borderline hypertension, that seems to exacerbate after that. And they seem to have an increasing tendency to develop coronary artery disease. But I think it is also the lifestyle. Like I said, it's a new age disease. There are a lot of social, lifestyle, cultural changes that promote coronary artery disease. And I think that's where women are getting this. Women are no more housewives. They are out there working like men. They are stressed. They are exposed to the powers of stress. They also, because of stress, they take up smoking. And they don't have time to exercise. And I think all of this accumulates into developing coronary artery disease. It is a global trend, I would say. It's not only in particular reference to Malaysia.
Okay, so essentially it's the modernization, the modern lifestyle overall that is basically the key.
Absolutely.
The reason,
yes, right.
for the increased risk
it's a modern day disease.
Right.
Yes.
Right. Now, you've already alluded to some of the key risk factors. Any more or any specific ones that you want to remind our listeners of?
Well, I think those are the major risk factors, and people, I think, out there know what is diabetes, what is high cholesterol, like hyperlipidemia, obesity, and in the media and the magazines, on television, people speak about this, and I think at large the public is aware that they have to undertake all these measures to prevent cardiovascular diseases.
All right, we're going to take a quick break. On return for more with my special guest today, Dato Dr. Ghandhiraj Somasundram, on World Heart Day as well as Coronary Artery Disease, CAD overall. We'll be right back. Stay tuned or keep it on Facebook Live with us. Back in a few moments. Welcome back to What Matters. Calling you live in the studios this hour, live on Facebook as well at TraXXfm Official if you'd like to join us there. Quick hellos to Madhu, Sharudin as well as Shirley for jumping on board. And like I said, best way to get in touch with us and to drop us a comment or a question in the comment section of our Facebook live feed right now at TraXXfm Official. Yeah. Back to the interview of the day. This edition talking about World Heart Day and all matters to do with cardiovascular disease, specifically also coronary artery disease overall, affecting more and more people worldwide. In terms of age, it is affecting people in a younger age category and affecting more women as well overall due to lifestyle factors, essentially, yeah, Doctor?
Yes.
Speaking with my guest today, Dato Dr. Ghandhiraj Somasundram, on this particular topic. Now we're talking about the fact that, more and more younger people, more and more women essentially are coming down with a coronary artery disease. Would you say that the situation is critical in a country like ours? I mean, we know that obesity has become, pretty much critical as well in the past 5 to 10 years or so. What about for heart disease?
Well, I think definitely so, and I totally agree with that. It is becoming critical. It has been in critical standards, in the last few years. Like I said probably earlier, the last 14 years, the highest cause of death has been cardiovascular deaths in Malaysia, and the statistics show that about 17.9 million people actually 17.9 thousand people actually die of heart disease in this country, and the very fact that younger people are getting heart disease, it's alarming.
Mm-hmm.
I mean, it was the disease of the elderly people, so I think it is at critical levels. And if you also look at some of the risk situations, we find that 3 out of 10 people have high blood pressure. This is in people who are in their 30s and 40s, and 2 out of 10 people have diabetes mellitus, and 4 out of 10 people have hyperlipidemia, high cholesterols, and they found that about 55% of the 30-year-olds are obese in Malaysia. So all these sort of culminates into people developing coronary artery disease. And I think it's very important to create awareness, and World Heart Day is one of the platforms used globally, but again here in Malaysia, to ensure that people are aware of heart disease and how serious it is in Malaysia, and adopt methodologies to prevent this by early detection and prompt treatment.
Yeah. Let's segue into that. World Heart Day.
Yes.
Right. So it's been a commemoration, a health awareness, annual commemoration for quite some time now, right? Tell us a little bit of its background.
Right. The World Heart Day is actually established by the World Heart Federation, and it's basically established to create an assertive awareness amongst all individuals across the globe, and it highlights for them to understand that one has to control heart disease, adopt methodologies to prevent heart disease, recognize with early detection of the respective risk factors, and to reduce the premature deaths globally. It's a worldwide campaign. It is not only restricted, or neither it is does it involve individuals, but it also involves families, communities, the governments to fight cardiovascular disease. the fight has to be not only restricted to a particular individual or a community. I think the government also has to play a huge role in recognizing this in terms of funding, building facilities, for early detection and treatment for cardiovascular disease.
A great point there. Is there any particular angle or theme that is emphasized for the edition this year, 2020?
I think it's just basically recognizing heart disease and understanding. And, a lot of people out there do not know what heart disease is all about. They're too busy with their lives, currently, absorbed in the situation with COVID and so on, loss of jobs, unemployment. So, of course, when World Heart Disease comes, they have to take all this into factors. And I think it's just creating a general awareness. Of course, we have the COVID situation, the COVID-19 situation, but we also have heart disease, which taking away, 18 million people every year. Right.
So awareness is key, as you were saying, right? And number one, thank you so much for coming in to the studios to talk more about this, and also for all your other endeavors in creating more awareness towards overall heart health.
Yes.
Right, which is super important, and I think many people should be more proactive about. In which case, right, what would be the key factors to watch out for? I mean, for all of us. I mean, because without going to an extensive medical checkup, or are there any specific criteria that we need to be more focused on when it comes to a report from a medical checkup, for example, or do you go in straight away for some sort of one of those cardiogram type analysis?
Right.
What would your recommendation be for all of us to be more aware of the state and condition of our heart health?
Right. I think first and foremost, it's actually awareness. I think among the young people are too busy with their university education, their first jobs, getting married and settling into a young family, looking for a house, buying a car. But I think what is really important is also matters of the heart. So when you reach about 30 or 35, I think it is important to adopt a healthy lifestyle, regular exercises, make sure you eat the right food. There's a lot of bad food out there, as you know, as all of us know. Yes. So exercising, the right healthy diet, and if you have history of heart disease in the family, or diabetes, or high blood pressure, or high cholesterols, or if you're a smoker by any chance, you have to cut down smoking. And if your body mass index is beyond, it says that you're obese and you have to cut down on your weight. So I think awareness is key. The second thing is if you have any risk factors, you have to take prompt treatment. And of course, you can go for cardiac screening, as you mentioned. An ECG and an echocardiogram to image the heart, to look at the function of the heart, as well as to do a treadmill stress test if it needs be. So if you see a cardiologist or a heart specialist, they will be able to advise you. But I think the bottom line is awareness and what heart disease can actually do to you if you do not, take prompt measures to treat yourself or look after yourself.
Right, and it all starts at the most fundamental core, I think, with just like the basket of non-communicable diseases, isn't it?
Yes.
With control as well as having a healthy as possible lifestyle.
Yes, absolutely.
I was just thinking throughout this interview, it's like Malaysia is officially a developing country, but in terms of food, in terms of lifestyle factors, I think we are, quite first world on that perspective. And along with it comes a lot of these so-called first world issues, including for our own health.
Yes.
As well, isn't it?
Yes. Well, it's a great country to live in, great food. But I think one has to be very careful in what they do to look after themselves. Yeah.
Exactly, right. And thank you so much for coming in for reminders on keeping our heart healthy. And it all starts with awareness, as Dr. Ghandhiraj was saying. Before we wrap up and before we let you go for the session, Doctor, any final messages for our listeners and viewers today?
Well, like I said earlier, I think awareness is key. You must know that there is a devil lurking around there to kill you, that is heart disease. As you know, the last 14 years, cardiovascular disease has been the highest in the country. And whatever it takes, it may cost you a little bit to go and screen yourself, to look after yourself. You have to do that bit to have a good quality of life and longevity in your life. And besides that, what I represent, the Medicare Cardiac Diagnostic Center, it is a charitable center. It's a 12-bedded heart-dedicated charitable center. It has 6 experienced cardiologists and a team of medical specialists to cater for the underprivileged and the low socioeconomic groups of people in this country. And treatment can be available at very affordable and subsidized rates. As you know, the underprivileged people with heart disease, which form the major portion of people who actually die in this country, they don't get immediate access for prompt treatment in the government hospitals. Not because they are not good, because of the volumes of patients. The government hospitals cannot treat patients very promptly. There are long waiting lists.
Right.
So we are a midway where they can come for affordable care, where the private hospitals are too costly for them. And most of them don't even have a medical insurance.
Okay. Well, perfect. And, for actually filling that void, I think it a great purpose that's served there.
Thank you. It is the first charitable cardiovascular treatment center that we have built in this country. That's the Medicare Cardiac Diagnostic Center.
Right. Of which Dr. Ghandhiraj Somasundram is the Medical Advisory Committee Chairman, right? And here with us to talk about World Heart Day, as well as to share with us the function of the MAA Medical Cardiac Diagnostic Center. Yeah. Thank you so much, Doctor.
Thank you very much, Kongi.
You're welcome. And thank you for joining us online. As always, we encourage you to share the information by sharing this link once we go off live. And the link will be on the Facebook timeline of TraXXfm. Yeah. Thank you very much to YBhg Dato Dr. Ghandhiraj Somasundram for coming in to talk about all things related to our hearts, focusing on cardiovascular diseases, especially coronary artery disease, and dispensing some valuable advice there for all of us. Appreciate it, Doctor.
Thank you. Thank you for the invitation.
You're welcome. And that gives a wrap to our segment today. Thank you for joining us on air as well as on Facebook Live. We appreciate it as we wrap up for today, the edition dated Wednesday, 30th September 2020. My name is Kong Yu. Much more to come on Trax Momentum all the way till 2 p.m. So make sure you stay tuned right here on Trax.